Screen visible?
Yes, ma'am.
Uh, no, I don't know if I'm not able to see it. Stop presenting. Hold on, let me check if I can present it in a better way. Oh, is it visible now?
It is visible, ma'am, but not in full screen.
Now?
Not in full screen.
Okay, for me it is in the full screen. Slideshow mode. Now, is it visible in the slideshow mode?
No, ma'am.
Okay, sorry. Uh, how do I do it? Wait, let me see.
It is okay, ma'am, if you.
It's okay. We'll
Okay,
start
yeah.
off, but it's not visible. I think, no.
The content are visible, but not in slide share mode.
This
But
now?
you may continue.
No, is it visible now?
Yes, ma'am. This content, second slide, it's ma'am.
No, I have put it in a slideshow mode.
Currently, it's showing the second slide, content.
Okay, okay, the content slide. Okay, let's start
Yes.
off. Now, in your third block of BHM-101, we have um, these aspects looking at infectious healthcare waste, what is its effect on human health, and also the impact of hazardous waste and elements of waste management plan and healthcare waste management plan, management planning tools. Now, let me ask you, is anybody involved in waste management planning to establish a system of waste management? Has anybody been involved here? Have you set up any systems in your hospitals? Has anybody been involved? No? Nobody is involved?
Mm, no, ma'am. I am currently a student.
No, student, but then you would have been involved in any of the planning of this. Has anybody done anything? Nobody? Okay. Now, in generally, how do you plan? In general, forget the waste management part of it. I want you to understand generally how do you plan for anything. Now you will have assignments to write, you will have some reading to do. How do you basically plan? Even if you have to write the term and examination, also there should be a plan that you will follow, right? How do you plan? Yes. How do you plan? What are the aspects you look at when you're planning?
What are the available resources like manpower?
Mm,
What are the guidelines available?
mm,
Uh, uh, manpower, materials, all the
okay.
things.
Mm. Then?
Then what are the guidelines available?
Guidelines. Say, for
Like,
example, if you have to plan for your examination term and examination, what how will you go about planning?
so what are the available resources, book, materials
Mm,
from where
mm,
we will get the information.
mm.
Uh,
And that's all. That is only information part. What about the others?
then then we'll make a map like
Uh,
what are the things we will have to do.
mm. You'll make a map. What are the things you will have to do for what?
Yeah.
To gather
For the test,
information or for preparation?
yes, ma'am.
For what?
For preparation,
For preparation. Okay, then.
yes. Yeah. Then we have to execute that.
Plan. Now, what
Yeah.
else you require for planning? Is this enough? Just gathering resources is enough? Is this Anu Sharma? Can you please mute yourself? There's a lot of background noise. Thank you. Yeah, please go ahead. See, if I have to plan, I'll have to plan. Say, for example, if I have to plan for this own session, now I need to know who's my audience, right?
Yes, ma'am.
What is the background they have? What is the thing that I need to present or I need to do it? Where are my resources? How much time I have given? How much time I've been given to present this or to discuss this? And how am I going to do it? Within that time frame, am I just going to talk, or am I asking you any questions and getting you to interact, or give you some reading material and then ask you questions on it? So this is how usually anybody would plan. So the plan would include what is the objective for which we are planning, are there any rules and regulations that are there in it, what are the resources I have for me to achieve that. Resources can be men, material, money, and time. So all these things can be acted. For an examination, you would see as I would want to know how much time I have, what is the syllabus I'm being evaluated for, and how in within the time frame that is given to me will I be able to complete my syllabus to read, and what is the effective way of completing the reading of syllabus within the shortest period of time that I have. Right, in that way maybe I
Yes,
would
ma'am.
go and plan, and I will also look at what are my strengths. Is my strength, uh, there are certain things which I would know already. I need not have to work on that. There are certain things which I need to read specifically newly, so those things I might have to spend some more little amount of time. So, if I have to plan to set up a healthcare waste management system in a hospital, what is it that I should know? What is it that I should know? Just as I said, if I have to give a term and examination, I will be looking at all these things. Similarly, if I have to plan for establishing a system of waste management in a hospital, what are the basic things I need to know for me to set up this?
First of all, what type of hospital it is? Is it a private nursing home, clinic?
Or,
None.
hmm.
Like
Nursing
how
home.
many beds are available?
Very good. Then
Number of beds.
yes. Then
How many staffs are work? What are the departments we
how?
have?
What
Like
are the departments
lab,
you have? Yes,
OPD, lab,
labs.
wards,
Okay.
and how much amount of biomedical waste is generated?
Very good. How will I know how much amount?
Number of bins. How many departments? According to the departments,
Okay, according
can
to the
estimate.
departments, what you will get are the services, right? Like,
Yes,
suppose I have surgery, I have OBG, then I have laboratory services that are there. kept looking at that, that means to say I would generate laboratory waste, I would generate placenta human body parts as a waste, because there's a labor room that is there, and OBG is also there with me system. Then if
Yes,
there is
ma'am.
a pediatrics also there, then I would have a lot of immunization waste that is
Yes, ma'am.
generated. Right. So first and
Yes,
the
ma'am.
foremost thing, as you said, I need to know the details about the healthcare facility that I'm catering to. What are there only OPD, or whether there is any inpatient facility, whether there's an OT, whether there's a labor room, whether there's a laboratory facilities. The different kinds of services that are being uh, provided to the people is one of my foremost things. So when I know the different kinds of services, excuse me, I will get an approximate idea, kind of different categories of waste that is generated. What are the different categories of waste that is generated? Yeah, tell me please, what are the different categories for the example what I've given?
Like red, yellow, blue.
Red, yellow, blue. Okay, if I don't know whether they're red, yellow, or blue, then how will I definitely tell, like, these are the waste that is generated?
Yes, ma'am.
You're telling it red, yellow, and blue because you know those are the color coding that is
Color
there.
coded. Yes,
Ah,
ma'am.
okay. Now I also leave the color coding across. Then tell me, what are the different kinds of waste that is generated in a hospital? Suppose the
Uh,
hospital has got basic minimum, one general medicine, one pediatrics, one OBG, and one theater is there. That
yes,
means
ma'am.
the operation theater or minor theater is there.
Uh, the placenta, and
Okay.
the gloves, bandages,
No, tell me.
tubes,
Okay, those are items. Tell me, can you group them and say in like say infectious waste or body parts are generated? Then can you tell me like
chemical.
that? What else is there? I want the others also to talk. It's just not one person. Yeah, please.
Liquid waste, chemical waste,
Liquid
uh,
waste, chemical waste,
sharp waste like needle
sharp
syringe.
waste. Okay, all these waste are generally generated in any of the healthcare facility. Red
Blood
level,
fluid,
Ma'am, what are
human blood and the blood products, just body fluid.
and blood products are also there. Okay,
हाँ शार्प जैसे
sharps. Okay.
हाँ शार्प में हमारे जैसे ब्लड ब्लेड वगैरह जो आते हैं ये सब
Yes, yes, blades and other things.
Glassware.
हाँ और
Glassware.
ये पैथोलॉजिकल वेस्ट जो होते हैं
Mm,
ma'am? There's in
हाँ
medicine.
जिसमें हमारे ऑर्गन्स
mm,
तरह से
mm. Okay, so these are the different kinds of waste that is generated. Now, do we have any idea in terms of, now we know what are the different kinds of waste that is generated, but I don't know how much of each of these is generated.
Yes.
Say, for example, in your own houses, if you want to segregate your general household waste into biodegradable waste and non-biodegradable waste. Okay, you understood. Wet waste and dry waste, it is generally called in a household. Now, what will be the size of the container of wet waste in your house? Wet waste is biologically degradable waste. And what will be the size of container of dry waste? That means it is like, say, paper, plastics, and all those things.
यस यस
Dry waste. Now, how will you decide which container would be better, assuming that there is an
ग्रीन बैग एंड ब्लू बैग
uh, green bag?
According to number of person in the
How
family,
how big should
consumption.
that bag be?
Ma'am,
How big should that bag be?
ma'am, according to the situations of and the uses of the members and
Members and
yeah,
their consumption, right?
and their
According to,
consumptions.
and their consumption. So probably based on that, you will have. And even if I look at that also,
In the
uh,
hospital range, we can be considered according to the bed sizes and the patients coming
huh,
in the
huh,
hospitals.
that is in terms of inpatient. Suppose this, we don't have an inpatient, and what about the outpatient?
most of the time, sometimes daycare patients come to hospital and they are going to the outside the hospital.
Mm-hmm.
They also generating some types of the waste. They are coming in the hospital and
Mm.
taking the medicine, and they, sometimes they also consume and drop out of there.
If you
And
look
such,
at it, in most of the places wherever cancer treatment is given in
yeah,
chemotherapy, it is a
daycare,
daycare.
yeah, daycare patients.
Daycare, that means morning they'll come, they will start the medication, they'll do some preliminary investigations and start the medications, and then send them back to their home by evening 4 or 5 o'clock. They're back home.
At that time, in chemotherapy, there is some medications. There are some in vials, and they are also empty, not completely empty, and they are available on the
I
results.
didn't quite understand, doctor.
Hello,
Can you please
I
repeat what you said?
I said the sometimes the medicines are not fully used there. They are
Ah,
also remained, and they are also causing some hazardic.
yes, they also cost. So for us to plan, I need to know, just as you said, the number, the quantity that is being generated. Now, the quantity generated can vary from day to day. Right? Today, I have lot of people coming in. Tomorrow might be a holiday, or day after tomorrow is a holiday. So therefore, you will have after holidays the number of people who walk in the footfalls for the hospital might be more. But before the holidays, it might be more, it might not be more, right? So I need to know the quantity that is being generated. So it varies from day to day, it cannot be the same. So how long should I keep observing? There's something called as a waste audit that we do. How long do we do a waste audit?
Every month and the quarterly and the year basis.
No, I mean, for us, we just need, for us, if the to start it off, we generally do it for a week.
Okay, for the week.
For
Okay.
a week to find out if there is any variation in the amount of waste that is generated on an each day, for us to determine how big a container we need.
Mm. Uh,
Right, how much quantity our containers should should be big enough so that it can take an overload, and also not too big enough that times when there are no patients, that means it looks very big and odd. That way also it shouldn't look. So we need to have a balance of both of it, right? So we need, since we need to have a balance of both of it, we would like to have something. For that, we need to actually look at how much of waste that is generated over a period of week, and then decide how big our container is should be. And at the same time, we also need liners. So once you decide the containers, we may also require the liners, and decide as to how many times the waste needs to be lifted, decide as to who, what else do you think you can decide in the waste plan apart from the quantity?
but
You know,
their stages of their these chances of contaminated
Hmm.
stages.
Hmm. Okay, so we need to look at what is more contaminated and what is not contaminated. Fine.
Okay.
Now, apart from that, suppose I have somebody who's going to pick up the waste on my behalf. I am in my hospital. There is a common treatment facility for which we are having a liaison. They'll come and pick up the waste. So, where should I keep this waste until they come and pick up? Is it in the ward or is it somewhere else?
Separate storing area for the
So
BMW.
I need to plan for a storage area. And apart from that, how will I transport my waste from the ward to that storage area? When will I do it? How will I do it? Who will do it?
Yes, ma'am. That trolley and that person with PP.
Trolley trolley and that person is fine. But what is the route I am going to follow from point A to point B or point X to Y? or in the way going to point A to X, I also go to B, C, D, E, F, and then come to X. How will I cover those points? The train, I mean the map of that particular thing also is necessary for that, so that we decide which waste is collected first, and then from where that waste material goes to the interim storage point. So this is very important for us whenever we are looking at a plan. So now, very nice. You have decided, you have observed a place for 1 week, and then decided this is the container I want. This is the, say, around 15 liters or 50 liters or whatever is a container you have decided. And these are the different categories of waste that we have. Whatever be the type of waste that is generated, for us, we have four categories as per the regulation, that is yellow, red, blue, and white. In yellow, what all waste goes into the yellow bin?
Ma'am, can you just giving the review of this coloring differentiation, because there is confusion.
Excuse me, what did you say?
Ma'am, just give a little brief over this coloring differentiation.
Oh, color. Okay, okay. You want the color coding thing to be giving a brief. Okay.
Yeah.
What goes into yellow? Yellow, we have uh,
Human anatomy,
human anatomical waste is there. You have the
ब्लड
microbiology and pathological waste is there.
solid
Then
ब्लड
waste,
प्रोडक्ट्स के लिए मैम
uh,
ब्लड प्रोडक्ट्स एंड द बॉडी फ्लूइड्स
solid
bread products. Yes.
solid waste.
Solid waste, soiled waste, all this and pharmaceutical waste,
Chem,
discarded pharmaceutical waste also goes into this.
chemical, all.
Chemical waste is also yellow in color. Okay, yellow color takes the major chunk of most of the waste that is generated in a hospital. Fine. Now, what we need to remember is whatever we drop it into the yellow bin goes in for a incineration.
Incineration, right.
So, if you are discarding anything into the yellow, just remember that this goes in for incineration. Should I incinerate this particular material or not is a question you need to ask yourself. Am I clear?
Yeah.
Second color. What red? What
Uh,
does this red contain?
recyclable,
Plastics.
yeah.
प्लास्टिक्स जितने भी है आईवी सेट्स हमारे ग्लव्स
Ah,
सिरिंजेज
all recyclables.
all
हाँ
recyclables are there in the red.
प्लास्टिक आइटम्स
Plastic items. Don't bring in contamination part here, because whether they are contaminated or non-contaminated, it can be recycled. So all that goes into the red. So the
Ma'am,
next thing,
ma'am, in the book here it is mentioned the contaminated waste and the recycling waste are coming in the range of
are coming in the,
red range,
yeah,
red
that's
pack.
what I'm trying to say. Whether contaminated or not contaminated, it goes into red. Even
Okay,
if it is contaminated, don't think that it is contaminated. That's why I'll put it into yellow. No, it goes into red itself.
okay,
Because, say for example, you have the Eurosac
yeah,
catheter. With that, Eurosac is there. Now Eurosac is contaminated with urine right now. You remove the urine, the urine can be flushed into the sewage system or your latrine, whatever is there. You can washrooms, you can flush that down, and the Eurosac, however, is still contaminated with the urine body fluid. What do we do with that? We, though it is contaminated, it is put into the red because there is plastic and it is recyclable. Our idea is not to burn anything which is uh, which where there is a chance of chlorine presence over there, and where it leads to dioxys and furan formation. So we try to avoid burning, but there are exceptions to the rule, like say blood bag. The blood bag is the only plastic which is put into the yellow bin so that it is incinerated. Okay, but before putting it into the yellow bin, it is actually undergoes a pre-treatment. Now, okay, that is about the red one. Then what else we have? What are the other colors we have?
Blue and white.
Blue and white. So what
white.
is there in blue?
ब्लू के मैम जैसे हमारे ये है
मैम ग्लासवेयर,
ग्लास
ग्लास
glassware,
ग्लास है,
metallic
metallic
ईटिंग
implants.
ईटिंग आइटम्स में जैसे जितने भी हैं,
no, impulse and vials, impulse and
वो
all the
वो वायल वाले उसमें जाएंगे, ब्लू
नहीं,
प्लास्टिक में जो आता है
नहीं
वायल।
अच्छा
टॉक्सिक।
अच्छा, वो जनरल वेस्ट का है मैडम। हम बायोमेडिकल वेस्ट के बारे में बात कर रहे हैं। वो ब्लू भी एक ब्लू, मगर ब्लू का शेड थोड़ा अलग है इसका और
हाँ
उसका
जी,
मेरे ख्याल से। आप जरा देखिएगा।
It's a
वो
dark blue.
हाँ, डार्क ब्लू। द ब्लू, ब्लू फॉर बायोमेडिकल वेस्ट, हियर यू हैव metallic waste and glassware is what it
ग्लास
goes in.
एम्प्यूल्स।
Ampules, all those things. Don't get
Yes.
confused with that of the general waste over there. Okay. Then the
यस,
next one is a sharp waste. Why
शार्प
sharp
में,
waste all go into the
शार्प में ब्लेड्स जाते हैं हमारे,
blades,
ब्लेड नाइफ।
ampules. No, ampules, no, blades, needles, hypodermic needles, sharps, all these sharps will go into it.
हम्म,
Fine. So
यस,
in general, this is what we have in our. It's yellow, red, blue, and
White.
white. So white container is a
शार्प
puncture proof.
कंटेनर।
No, it is puncture proof and tamper proof container,
Metals.
not metals.
मेटल ब्लू में जाएगा।
नहीं मैम
No,
वेस्ट
no. See,
वाइट
needles
में
are
वाश आ रहा है।
metals. Needles are
अच्छा,
metals.
या
अच्छा,
Okay, if that is how we are looking at, no, instead of calling them as metals, you better tell that needles go into
needle
puncture proof,
syringes.
leak proof. No, not all syringes. Syringe, where does the syringe should go?
मैम दे आर द सम
रेड में, सिरिंजेस रेड में जाएंगे मैम।
Syringes have to go to red.
मैम all pre-filled syringes are come in this range.
No, not pre-filled ones. I would say the place where you cannot remove the needle from the syringe, those will go intact into the sharp one.
Okay, right.
When you cannot remove the needle from the syringe, where the needle is fixed to the syringe, those are the ones which go into the white. If you can remove the needle from the syringe, then the syringe goes into the red and the needle goes into the white bin.
White, right.
Okay, this is in brief about the segregation part of it.
Thank you, ma'am.
Okay, now what we need to understand in blue is white is that it has to be tamper proof, leak proof, puncture proof container. Now, when I'm planning for a setting up of the system, I need to know how much of this needles are generated, because this box, what we have, tamper proof, puncture proof, leak proof container, will go as it is to the common treatment facility. We are not going to remove only the needles and send them. No, with the box, you are sending it once it is 3/4 fill. So, for us, waste audit becomes very important because it's a recurring cost that happens to the hospital. So we have to be sure about how much of these boxes is required or how much time is taken for the box to become 3/4 fill so that it can be disposed of. Am I clear here? That's where your waste audit comes. In the waste audit, you're looking at the different kinds of waste that is generated, amount of waste that is generated, and what are the feasible options for a disposal and treatment mechanisms that are available in the hospital. Okay, I also need to look at pre-treatment mechanisms in the hospital. Some waste needs to be pre-treated before I send it to the common treatment facility. So therefore, that is also necessary for us. I need to look at what are the pre-treatment facilities that is there. Fine. Now, this is with regard to materials that have been generated and materials that are required for us to do the segregation, right? Is only segregation part of waste management? What are the other things that are there in waste management? Yes. What are the other components of waste management you know of? One is segregation, two is selection, containment and storage. Then third is transportation, and then the fourth is disposal mechanisms. Is what.
disposal.
Then
transportation and
in the
logistics.
common treatment facility is where treatment and final disposal happens. Okay, that means to say, as per your rule, even if you have a diagnostic facility which caters to a very limited number of people, even then you need to have a liaison with the common treatment facility person and also generate how much of waste that is generated and how you are transporting the waste, to whom you are transporting the waste, and how is the waste treated in their particular facility. These are some of the details which you need to have when you're planning for a biomedical waste management system there. Then, okay, what are the things that will affect us from doing an effective plan? Look, you have a 20 bedded hospital, you need to set up a system over there. So how will you go about it? Yes, come on. Come on, come on, come on, come on, come on. I need the answers.
Uh, what the need of this questions means?
What?
What? How can we differentiate one, ma'am, in the according to patient requirement or the according to the uses of this,
About what?
the waste generation or
Waste
segregation?
generation is for the hospital.
Okay.
Patient requirement, it is indirectly required by the patient, because if your hospital doesn't look clean with all these processes, then your input might patients may not be willing to come. Aesthetically your hospital will not look good. And another problem you are going to face is that because of mismanagement of waste, you have issues where your personnel are affected, people around the hospital are affected, and the environment is affected.
Ma'am, in my opinion, I just want to share something.
Hmm.
First of all, we are looking for the degradations of the waste
Hmm.
and segregation of the hazard or non-hazard, and
Mm-hmm.
integrations of the waste management. Looking for based on if is it means is it radiational associated or not.
Hmm.
Second thing, we can go for the training of our staff
Hmm.
to initiating on the first stage of the segregation and taking care of and removing their self for the protection maybe uh, for the contaminations and
Mm-hmm.
further we can go for the transportation and management of the waste.
Okay. So transportation and management of the waste, there are two things. One, in-house transportation.
Yeah.
Two is from the hospital to the common treatment facility waste, common treatment facility center.
uh,
So there are two parts of transportation that you need to look
because
at.
ma'am this small hospital like 25 they are not have the common facilities, so they can be associated with another uh, centers.
No, 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 no. What does the rule say? The rule says if there is a common treatment facility that is situated within a 75-kilometer radius of that healthcare waste, of that health facility, that means that health facility will have an MOU or should have an MOU with the common treatment facility person, so that the common treatment facility person can come and pick up the waste from their particular health center.
Okay.
They cannot treat or dispose waste on their own. They have to have this liaison with the common treatment facility person. It applies even for diagnostic labs. It applies even for even of smallest of the smallest clinic. As per the private, you know, private medical centers, we need to have
Like clinics.
clinics also. Okay, as per the act, they have to get registered under the district health officers. The district health officers, for them to register any of the clinics or health care facilities, they will ask for an MOU. This is a prerequisite. They will ask for an MOU with the common treatment facility person. Only if they have that MOU written down, then they will allow you the permission to set up this particular clinic or particular healthcare facility. And these licenses and these authorizations are to be displayed. It is not like I'll just keep quiet. I have got the authorization and I'll keep quiet. No, that's not how it goes. Okay, now for us, let's look at what are the things uh, that will have for a what are the things that should be a part of the plan for any waste management. Components of healthcare waste assessment. What should I look at for? I have to look at for the basic facility data, information on various waste generation amount and categories. What is the practice that is followed? Practice is usually segregation, transport, in-house transportation, storage, and then handing it over to the common treatment facility person. Um, Practices that are related to collection, labeling, and packaging, and on-site disinfection or pre-treatment. Does the rule says that anything that needs to be disinfected? Are there any waste categories that need to be pre-treated? Are you aware of them? What is pre-treatment? What is pre-treatment of waste? Somebody needs to answer this.
Ma'am, dipping the waste into hypochlorite solution so
Why should
that it
I
can
do?
get decontaminated.
Uh, it's not just dipping the waste into hypochlorite solution. We need to remember one thing. Any waste which is having contaminated, most of the waste are contaminated, which we
Yes, ma'am.
feel that if
That
I don't disinfect and send it to the common treatment facility, in the process of transportation to the common treatment facility, it should not harm anybody else, or it should not even cause harm to the environment. That this is where it comes in. Say for example, the needles are there, you have put all the needles in a common white translucent tamper proof puncture proof container. What does the rule say about the disposal of the needles? It says once it is three-fourths fill, hand it over to the common treatment facility person. Now since these are needles, all hypodermic needles, there are chances that there could be some amount of blood inside this hypodermic needle. When it pierces or injures anybody, who is at fault?
right.
The occupier?
No, ma'am.
The
Waste.
occupier.
Yeah,
Yes, the occupier is at fault.
yeah.
So what should the occupier do so that he minimizes this injury or minimizes the effect, minimizes the chances of transmission of any diseases to this particular person?
The training should happen at regular pace so that everybody is well trained and well versed with the facts.
Okay, that is with regard to training. Apart from that,
Ma'am, some cases like the bed sheet is they are also the contaminated. This is contaminated,
hmm?
and they are also the chances for the pre-treatment or not. Some patients' bed sheets and all that.
Yeah. See, if you're in a position to discard those bed sheets, and that means the bed sheets are no longer to be used.
But we have the ma'am. Some cases we have just seen they are giving to the this washman and the dry
Yes, you
cleaning.
have
They are
to disinfect. See, pre-treatment means you are treating the waste so that if there is any infectious agent that is attached to it, or if there is a chance, if I send this particular material without pre-treatment, there are chances that any diseases can be spread through it. So those are the ones which we generally look for pre-treatment. So I cannot keep on looking at which is infected, which is not infected. So I have certain criteria or category of waste that undergoes pre-treatment. One is all your biological and laboratory waste. Microbiological and biotechnological waste that is generated in a laboratory has to undergo pre-treatment before it is sent to the common treatment facility. Okay, all of them need to
All
be
biological.
all by no the laboratory leftover. Say for example, serums, um,
Blood bags.
yeah, blood bags are to be pre-treated. Whether used or unused, have to be pre-treated. Your blood and no, you collect blood and urine samples for testing, right? In the laboratory, whether the person is having disease X or disease Y. For us to come to a conclusion, we generally do a blood test. There are specimens that are left out of that blood test. Some amount of blood or some amount of serum remains. So what do they do with that?
Go for the first pre-treatment.
You have to go in for a pre-treatment, and all the liquid waste that is generated, your washings you can have, your disinfective chemical disinfective agents that you use in the hospital, all of them are waste that is generated. And once they are generated, you need to, some of them needs to be pre-treated and sent it across, especially liquid waste. Another thing here is that we want to keep the hospital very clean and see that there are not much of infections that are spread across. If I really want to keep the hospital so clean without any to see specifically see that not the micro not many microorganisms are spread to the patients, what should I do?
And there also may be the chances of this contamination.
So I need to do a pre-treatment there.
Yeah,
I need to do a pre-treatment there. And what else can I look for pre and right? So pre-treatment is essentially. So when I'm planning, I need to know what quantity is there for a pre-treatment. What is the methodology I'm using? I need to have a policy for this, and then whether I'm going to use a microwave, what is the technology I can use for pre-treatment, whether it's a autoclave or a microwave or any other chemical disinfectant. These are certain things which we need to decide and dedicate a place for this. At the same time, if you look at the hospitals, many of the hospitals are built prior. They may not have a place for interim storage. So you need to identify a specific place for storage. All right. So these are some of the aspects what we look at. Now, this is just the planning what you said. Now, what does the rules say for us to plan? There are certain things that are expected out of a healthcare facility with regard to biomedical waste management. One, authorization is the first thing they'll ask. Two, your annual reports, what you need to send. There is documentation that needs to required as to quantum of waste that is generated in each of the categories of waste. They'll ask you how many times you have been able to conduct trainings for people in your hospital. That is, they'll ask this. They'll also ask which common treatment facility person you are handing over the waste to. They should be mentioning that. And they'll also ask what sort of safety mechanisms you have given to your employees with regard whenever employees who come under um, who are handling waste. We call it as occupational health or health records. You have to specifically do a health checkup of all these people, and these records and documentation should be maintained. So you have to plan for all these things. And you also need to immunize them against hepatitis B, any healthcare worker, because you never know when a needle prick injury can happen. Now, for us, immunization against hepatitis B is possible. So that is where it's a saving grace for us. Even if there is a needle prick that happens with a contaminated blood, I am at least protected because I am vaccinated with hepatitis B. So you have to plan for the vaccinations, you have to conduct training, and the personnel keep changing every time. So therefore you need to have a plan where there is a repeated times where it can be conducted. So all these aspects should come in your assessment or your plan for healthcare waste. Now this is only one part of it where you physically know this is what is happening. There are another things that you need to look at as what sort of chemical disinfectant I am going to use. How safe are my chemical disinfectants to the public health as well as for the environment? Now, if you go back to the origins, how and why the rules of 1996 came in, or even before that, that came in, was it was basically an outbreak of hepatitis B that had happened because of a negligence of one of the uh, doctors who did not bother to see whether the needle that was used to give injection is a single use needle and they were not being repeated on others. So these were certain things which was overlooked and it led to a hepatitis B outbreak. So we need to be clear about these things. That where was I? What sort of disinfective agents that I'm going to use, and how am I going to manage these disinfective agents? Okay.
Pardon?
Yes.
Ma'am, just yesterday, sir has discussed the uses, minimizing the uses of all these disinfectant can be also causing the waste. This
What?
under
Can you repeat your question, sir,
ma'am,
please?
extra uses of this or the minimizing the this treatment chemicals, whatever
Ah.
we uses there inside the
Hmm.
clinic or there. So
Hmm.
also the concern of minimizing.
Whenever you look at any of these, any of the waste materials, so for us, if you go by life cycle approach, you generally have reduce, reuse, recycle, and refuse are certain things that 3 R's or 4 R's that is looked at waste management. If I have to reduce waste, how can I reduce waste? Right? I need to know what are the processes that are doing. Can I do away with some of the processes so that I can reduce the quantum of waste, hazardous waste that is generated, quantum of the chemical waste that is required for me to, for me, can I reduce it? I need to look at it in that direction. Can I, suppose the waste is very hazardous and I find it difficult for me to handle hazardous waste, do I have a substitute for this so that the substituted chemical is not so hazardous as the one which I was using earlier? So for waste minimization, you have to give maximum weightage to it because that is the one which helps us in the long run to bring in certain changes and help us in waste management practices. One more thing, we also look at occupational safety. I think I've already mentioned this. I need to look at rationale for which I'm doing. I need to review the practices and what are the organizations that I have, what is the organizational structure, who is handling what, the roles and responsibilities need to be delineated very clearly, and how is it linked with infection control, safety, and quality. And I need to look at a draft plan for waste segregation, what procedures that need to be done, monitoring, and in an emergency, whom to contact and what to do. These are some of the important things that we need to look at. And one more thing, monitoring. Whatever said and done, you have established a system, but if you do not establish or do not bring in monitoring systems, then you may not have the system running smoothly throughout, because monitoring is very important for us. Most of the time, unless there is a fine, unless there is some penalty that happens because we are not doing something, only then we tend to do certain things. So therefore, how frequently you're going to monitor, who is going to monitor, what they're going to monitor, these are very important aspects. Who is going to, suppose you, who is going to monitor is somebody whom you have to nominate. Two, who is going to and two, What is the frequency? Am I going to monitor on a daily basis, on twice daily, or alternate days, once a week, or once in a month, or once in a fortnight? Is up to you to decide. Then what is it that you're going to monitor? Are you going to monitor just the segregation practices, containment practices, storage practices, whether the documentation is being done or not? So what is being monitored, what you need to monitor is also important for us here. Who is doing it, when they're doing it, how many times, what is the frequency which they're doing. You are assigning roles and responsibilities for each of them. Only then the system would work at the optimum. And one more thing, policy, what they need to look at is the drugs. How much is going to be indented? Suppose there is some drug which is nearing expiry. What is the policy of the hospital? Is there a liaison between the manufacturer and the hospital? These are some of the aspects which we also need to look at whenever we are planning for setting up a biomedical waste management systems in the hospital. Whatever is said and done, we have to follow the rules properly. What the rule says is something which you need to, which is mandated for you to set it up. But if there is something beyond the rule, for example, disposal of needles, it says you just put it into a puncture proof, leak proof, and tamper proof container. They have not said you need to disinfect it and hand it over to the common treatment facility. If you do it, it is well and good. Those are certain things which would gain a little extra points. That's all. But what is mandated by the rule book has to be followed to the T. If it says you have to pre-treat it, you have to pre-treat it with certain procedures. So these are certain things which needs to be set up in uh, any hospital. For us, for the hospital to run smoothly, waste management is very, very important. Now I would like to ask something here. What is the most toughest part in waste management?
The segregation, ma'am.
Segregation. Okay, then why do you think segregation is the toughest, man?
Ma'am, first,
Uh,
please.
Yes, Meenal, madam, please tell me.
yeah, ma'am, because people are not well trained for it, and they put it like they are not able to segregate it properly.
Okay, you feel because they're not trained, that's why they are not able to segregate. Fine.
Even if
Uh,
they are trained also, but some the manpower is not that good. I feel the training
okay.
is not well done.
Training is not well done. Fine.
Yeah.
Mr. Pawan Mishra, you wanted to say something.
Yeah, ma'am. In daily practices, we can be see in our healthcare setups, the
Hmm.
peoples are no so serious about this.
Ah, they are not serious about it.
Yeah, this is a basic problem. If they are serious and suddenly they can take care of all the segregation, if they are
Ah,
not serious, ma'am,
ah,
and in my opinion, I just seeing everywhere they are not serious. They
ah.
just putting it in here and there, and they just looking for the another person can take care for this. They are not.
Exactly. They are not owning their
They are less. Yes, yes,
responsibilities.
ma'am. This is the
If
basic problem, and this is the I think the major important focusing point.
my major problem is the attitude people have towards waste management. It is waste, right? It is not my job.
Yes, exactly.
Somebody else's job. I do the surgery, I do the treatment. I am not responsible for the amount of waste that is generated because of my treatment. I do not care if somebody else gets injured because of my treatment. It is the nurse's job or it is the ward boy's job. No, that doesn't work like that. The most toughest thing is the change in the attitude that we need to bring about in people whenever we are trying to do any waste management, right from the top management to the lowest of the lowest cadre of the people who work in a hospital should be aware of these practices, and they should also think that it is everybody's responsibility. It is not just the responsibility of the waste handler to do it.
Yes, ma'am. In
This is
every
important for us. Okay, so whenever you're trying to set up any system, we need to find out, there is something called as do a waste audit to find out the quantum of waste that is generated, have a clear cut idea about what sort of a facility it is and what are the different categories of waste that is generated. Once you know that, do a waste audit to find out the quantum that is generated. Then you bring in the policies that are necessary for us, policies in terms of written policies in terms of occupational safety, training. All these things can be written policies that you need to write down for yourself, so that it is easy for you to, for anybody to, monitor it. Then bring in what sort of monitoring systems are there. When it comes to reduction of waste, you will also have to look at what are the purchase policies that are there. Try and see if we can include only environment friendly system products that are used, which are biodegradable, and there is no more hazard to the environment. These are certain things which you need to keep in mind. Once the waste audit is over, you get to know the quantum. Create one committee which looks at these things. In a smaller facility, you need not have a big committee. One or two persons will be the ones who will be involved in it. Okay, so we need to have these things whenever we are planning a setting up of systems in a hospital. Now, what are the things that uh, okay, what are the things that affect your planning? Is your rationale specific financial investment? The most important one we forgot. How much money are we going to dedicate for this? You have to plan even for that also. Financial management, place management, and our practices should not harm either the human health or the environment is something which we need to remember. Okay, so when we plan poorly, we plan to fail. Yes, Anu Sharma, is there anything I can answer for you, or I can clear any clarification you have? You have raised your hand.
ma'am, I have a one query.
Yeah, please go ahead.
Ma'am, in some cases we have seen that and have a collaboration with pharmaceutical companies and the hospitals. If
Mm-hmm.
the drugs are the expired, they can be
Mm.
returning over there, right?
Mm.
But some
Mm.
cases the MO is not and they are not covering in the range of this time duration.
Mm.
Some drugs are in those stores in our hospitals and some inside is there, and they
Mm.
come out and they are expired, where we can be used and how we can be pre-treated that or not.
Okay, see, when it comes to expired drugs, most of the expired drugs have to be given to a common treatment facility where it is incinerated. Okay, only in some places where the pharmaceutical company has got a licensing, they will come and collect it so that the components of that particular drug can be utilized again. In
um,
places where it cannot be utilized, you have to treat it as expired medication and give it to the common treatment facility person.
Among the hospital, the pharmaceutical company are also same giving to the common center, or they are also have
No,
a
they can give to their own, they can give to the common treatment facility center if they have a, but why will they do it? They would, this same waste material maybe is a raw material for them for some other processes.
okay.
Okay, there are places where the active ingredient is extracted
A- APIs are there.
and then you use it. Extended, what is it? Extended producer policy or something.
But they are though expired and they are there is reusable or not?
I'm not sure about what sort of processes they follow,
Okay.
If the active ingredient can be extracted and it can still be used, probably they'll do it. Or else they might give it to a common treatment facility or some other facility where these kind of pharmaceutical waste can be incinerated at a higher temperature.
Ma'am, most of the incinerator center they just burning all the wastes, and some cases they are autoclaves and all. But
See,
everything they are just go for the incinerator and burning all.
no, everything need not go to the incinerator for burning.
But most of the things.
If you look at our segregation, as per the segregation, most of the quantity of waste that is generated goes into yellow. All the recyclables goes into red. So assuming that the amount of waste that is generated in the yellow category is quite large, actually it is, I won't say it is large, but most of it is recyclables. Your plastic waste is the one, the quantum that is generated is little more. So those things go for a recycling. Yellow, whatever you put goes for incinerator. That would include your drugs, it would include your oiled waste, solid waste, chemical waste, all these things going for incineration.
But ma'am, they are just avoiding these segregations of these waste in the common centers because some
No, no, no,
trans.
no, 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 no. They have to do it because if they don't do it, they are liable for action from the regulatory body. The common treatment facility person should not be segregating. It is the hospital which has to be segregating. It is the responsibility of the hospital to give segregated waste to the common treatment facility person.
My answer is for the person who is taking care of common center for
Uh,
the recyclable. They can be applicable, but they don't doing that.
I didn't quite get you. I didn't understand what you're trying to say.
Ma'am, whatever the goods we are collecting from the hospital
Mm,
go to the common center,
mm,
but in some goods they which is come in the category of recyclable, they
mm.
don't do that.
That means you mean to say that they don't recycle?
They yeah, most probably.
No, no. That is the place where they can earn money. So they won't. Why do you think they don't recycle?
Most because ma'am, I got chance to look over there.
Hmm.
So
Recycle. See, most of the plastic waste that is generated
because
is
ma'am, they are contaminated, so avoiding over this to because the person who is taking care of now, so they come for the all.
no, 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 no. See what exactly should happen in the in the red or the recyclable waste? Whatever waste that is generated there, once you hand it over to the common treatment facility person, it undergoes autoclave.
Right,
It is autoclaved. That means whatever is there in that plastic waste is disinfected through the autoclave. Then once it is autoclaved, it is shredded into small pieces. You won't be knowing what is what.
right.
The shredded plastic pieces are the ones that is sold to a and it is handed over to an authorized recycler, not any aira gara kabadi wala. He has to be an authorized recycler. You get my point. So
Yeah,
they
yeah.
will
Okay.
not waste something from where an income is generated. Why will they do that? In fact, many of the hospitals do not hand over their recyclable waste to the common treatment facility. They sell it separately on their own to get the earn some money.
Yes, ma'am.
Hmm.
They do that.
They do that. That is where the problem comes. If they give it to an authorized recycler, we are safe. But if they don't give it to an authorized recycler and give it to the person who has the highest bid on it, then it's a problem. Do you understand?
Most of the hospitals focusing on usable the goods, not managing the or minimizing the goods.
Yeah, yeah. That is a problem everywhere you see. Okay, if there are no other questions to ask, can I call it a day, or
Yeah.
is anybody having anything to discuss, any clarification?
मैम जैसे फीडिंग ट्यूब्स है, यूरो बैग वगैरह है, ये एक्सपायर हो जाते हैं तो क्या यूज हो सकते हैं रिसाइकल कुछ ऑटोक्लेव करके?
मैडम मेरे ख्याल से वो मुझे इट्स नॉट माय एरिया. देर आर सम पीपल हु थिंक दैट expired means I don't think you should be using it. But what expired means, these plastic items, that means to say that whatever sterilized or in disinfection that has been done is no longer holding good beyond that period of time.
uh, Anu ma'am, they are, most probably they are not reusable and will go for their this
No, no,
treatment.
no. What she's asking is, say for example, you have bought a set of infusion set,
Yeah.
and there is no chance that you have used it, and it has attained the expiry date. For example, the expiry date, you bought something in 2023, but now you, if you want to use the infusion set, that would be expired. So there are certain guidances from that particular company itself to find out whether you can use such kind of products or not. In general, once it is expired means that better not to use it. The disinfective processes, whatever that they have done, or sterilized processes, whatever that they have done, will only be applicable to that particular point. Beyond that point, probably it is not. So it would be unsafe to use it. Have I answered your question, Sharma ji? Anu Sharma ji?
Yes, ma'am.
Okay. Thank you.
Okay, ma'am. Thank you.
Thank you.
Thank you, ma'am.
Thank
Thank
you,
you.
ma'am.